Part 3 of mnemonics, musculoskeletal. These are the muscles that we are going to talk about here. Muscles of the face. Remember that mandibular nerve, or the third branch of trigeminal nerve, innervates the muscles of mastication, while facial nerve innervates the muscles of facial expression. The muscles innervated by the facial nerve. We have the 23 pairs of facial expression muscles, posterior belly of the gastric, stapedius, and stylohyoid muscle. These are the muscles of facial expression. Posterior belly of the gastric muscle is here. You have the stapedius muscle right here, and the stylohyoid muscle. Again, those are the muscles innervated by facial nerve. In summary, again, we have 23 pairs of facial expression muscles, posterior belly of the gastric, stapedius, and the stylohyoid. To remember, just imagine someone making a facial expression and says, "Psst," asking someone to keep quiet. Eye rotation is carried out by our oblique muscles. The superior oblique rotates the eye medially, while the inferior oblique rotates the eye laterally. So to remember that, we can use the mnemonic I love S&M. Rotator cuff muscles. These are the rotator cuff muscles. Again, the muscles, you have supraspinatus, infraspinatus, teres minor, and subscapularis. To remember, we can use sits, or think of a phrase, the arm sits on the shoulder. And there's another way of remembering it. TISS, T-I-S-S. Serratus anterior is innervated by long thoracic nerve. To remember, we can use the word SALT. Serratus anterior, long thoracic. Long thoracic nerve originates from cervical nerves 5, 6, and 7. Paralysis of this nerve will result in winging of the scapula, right here. To remember the origin of long thoracic nerve and the clinical presentation when it is paralyzed, we can use this rhyme. C5, 6, 7, raise your wings up to heaven. Neck injury to the neck may damage the long thoracic nerve or its roots that may result in winging or winged scapula. Also, stab wounds to the lateral thorax, anterior part, may also sever the nerve resulting in winging of the scapula. Latissimus dorsi muscle. This muscle attaches to the humerus in between the attachments of teres major and pectoralis major. shown here, the attachment sites. And to remember, imagine a lady between two majors. We have three erector spinae muscles. One is the iliacus longissimus muscle and the spinalis thoracis muscle. To remember, you can use I-like standing as your mnemonic. Abdominal muscles. There are four abdominal muscles. You can imagine a tire mark, then remember the word tire. These are the transversus, internal oblique, rectus abdominis, and external oblique muscles. Potentially absent muscles. One is the plantaris muscle, right here. Plantaris muscle shown here being measured, and close up, that's how small it is. Another muscle is the peroneus tertius muscle, shown here. Again shown here in a cadaver and also in a living person's foot. Another muscle is palmaris longus muscle, shown here. Also here, shown in a cadaver and a living person's forearm. Also shown here are different methods to identify the muscle on a living person. You can also try to identify your palmaris longus if you have one or none. Next is pyramidalis muscle. It's a small muscle in the abdominal region. Right here shown a pyramidalis muscle in the abdomen of a cadaver. And the fifth one, you have the psoas minor muscle. And in a cadaver. Again, these are the 5 muscles that could be absent in some individuals. These are the plantaris, peroneus tertius, palmaris longus, and pyramidalis, or the 5 P's muscle. They are all located in the body, like here. Remember, they are called the 5 P's muscle because their name starts with letter P. Let's go to bones. We have 7 bones to discuss. You have the cranial, facial, orbital fossa, vertebra, carpal bones, tibia and fibula, tarsal bones. Cranial bones. There are 6 bones of the neurocranium. To remember, you can use this mnemonic. All people from Tokyo eat sushi. Then facial bones, or also called as the viscerocranium, right here. These are the bones: the vomer, conchae, nasal bone, maxilla, mandible, palatine bone, lacrimal bone, zygomatic bone, and also the palatine bone. To remember, you can use this mnemonic. Victor cannot make my pet zebra laugh. Orbital fossa. There are 7 bones making up the orbital fossa. These are the frontal bone, zygomatic bone, maxilla, sphenoid bone, ethmoid bone, lacrimal bone, and the palatine bone. In the medial wall of the orbit, we have 4 bones, the maxilla, lacrimal bone, ethmoid bone, and the sphenoid. To remember, we can use this mnemonic, my little eyesight. Thoracic vertebra versus lumbar vertebra. Thoracic vertebra has heart shape. It's easy to remember because thoracic vertebra is within the thorax or along the thorax where you can find the heart, while lumbar vertebra is kidney shape because kidney is located in the lumbar region. So remember, thoracic vertebra is heart shape, lumbar vertebra is kidney shape. Carpal bones. There are 8 carpal bones. Again, we have scaphoid, lunate, trichitrum, pisiform, trapezium, trapezoid, capitate, hamate, as are carpal bones. We can use the mnemonic, sweet lovers try positions that they cannot handle. Tibia versus fibula. Remember that fibula is lateral. Tarsal bones. These are talus calcaneus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. We can use this mnemonic. Tiger cub needs milk, change K to C. This ends part 3. Up next, nerves.